Hello, my name is Nicole Carlson, and I am currently enrolled in the Medical Reimbursement and Coding Associates in Applied Sciences program at Bryant and Stratton College. I'm going to discuss with you today how the program institutional outcomes were met by our portfolio projects and in what courses they were met. The first one I'm going to talk about is the electronic health records. The institutional outcome was to demonstrate competencies to assemble, process, maintain, store, abstract, analyze, index, and retrieve health information data. We had a portfolio project where we had to describe concepts of managing data in electronic health records. We had to learn the importance of slowing down, how to recognize that entering all information carefully and right the first time would cause problems down the road and delays in payment and reimbursements. The second one I'm going to talk about today is human disease and drug pharmacology. That institutional outcome was met by culminating a case study. So the institutional outcome was to analyze the results of coded data to ensure medical necessity was met when auditing charts. We had to provide clear and concise responses for each section of that assignment, and we had to demonstrate the ability to apply the knowledge gained during the course of the weeks to develop the case study. The next item I'm going to talk about is the course of my ICD procedure coding. We had to meet the institutional information from medical charts to assign the correct diagnosis, procedure, and supply, which is the ICD-10, the CPT, and the HCPCS Level 2 codes in a variety of medical situations. In that portfolio project, we had a PowerPoint presentation on how to code using the ICD-10 PCS. We had to give a detailed process of how to code ICD-10 PCS along with guidelines. We had to include a voice, audio, and text references and do it in APA citations. The next course I'm going to talk about is clinical documentation, integrity, and quality. The institutional outcome was to evaluate the accuracy and completeness of the patient record as defined by policy, external regulations, and standards. Through that portfolio project, the outcome was met because we had to include accurate, thorough, and detailed explanations of the legal health record. We had to include accurate, thorough, and detailed explanations of all 7 criteria, which included accurate, thorough, and detailed description of the relationship between quality documentation and regulatory compliance, including accurate, thorough, and detailed action plan to address identified deficiencies from the audit to include physician and coder education. The next topic I'm going to talk about is the research and writing. The outcome was met by utilizing appropriate current technology and resources to locate and evaluate information needed to accomplish a goal, and then communicate findings in visual, written, and oral formats. We had to explore and compare 2 career paths using evidence from multiple sources to support our points in that portfolio project. The next class I'm going to talk about is human disease and drug pharmacology. The outcome was met by transferring knowledge, skills, and behaviors acquired through formal and informal learning and life experiences to new situations. In that portfolio project, we had a culminating case study, where we could provide clear and concise responses for each section of this assignment and demonstrate the ability to apply the knowledge gained during the course of the weeks to develop that case study. I'm going to talk about my computing skills class next. And that outcome was met by employing strategies for reflection on learning and practice in order to adjust learning processes for continual improvement. The portfolio project was that a student had to discuss in detail the importance of being able to locate information in workplace graphics, synthesize information found in workplace graphics, use that information found in the workplace graphics, and the student identifies and elaborates on the types of workplace graphics they anticipate encountering in their particular field. Next one I'm going to talk about is both my college mathematics quantitative reasoning and my workplace mathematics. The outcomes were met because we followed established methods of inquiry and mathematical reasoning to form conclusions and make decisions. For the quantitative reasoning, we had a student loan repayment project that was due, and we used mathematical reasoning to form conclusions and made decisions based upon loan repayments. For the workplace mathematics, we had to do a graph and pie chart to form conclusions on diabetic trends for male and females. The last class I'm going to discuss is my human disease and drug pharmacology. The outcomes were met by participating in social, academic, and professional communities for individual growth and to function as a citizen of a multicultural world. In that portfolio project, we had a culminating case study where we could provide clear and concise responses for each section of the assignment and demonstrate the ability to apply the knowledge gained during the course of the weeks to develop that case study. Portfolio project for week 7. And I thank you, and I hope you have a good evening.